everyone, to all of those who are watching this video right now. Thanks so much for tuning in. I hope you're finding my channel to be informative, and hopefully the videos are helping you get through some of the common aches and pains that I typically treat in clinic. Today I wanted to discuss low back strengthening and stretching exercises. In particular, I wanted to do a brief intro education on the low back itself, just to give you an idea of what this looks like on a model, and then to discuss a couple of different strategies to help you reduce some low back discomfort. So in particular, this is a model of the low back. We call it the lumbar spine. It's comprised of, this one has 4 segments, but the low back is comprised of 5 lumbar vertebrae. Each one of them has very specific structures to it: the lamina, the pedicles, the actual facet joints. So this is what they actually look like. This end here to the vertebrae, it's called the spinous process. So those bumps that you feel on your back, this is them. It's the most posterior aspect of the vertebrae. The most anterior part is here. So this is the vertebral body. Now, you'll see that there's a foramina, a hole there through which this structure emerges. That's your spinal cord. And off of each, at each level, there's pairs of spinal nerves that branch off, and those are what comprise the peripheral nervous system. So the lighting is a little bit poor, but basically, whenever we talk about, as a chiropractor especially, we talk about joints and manipulation of joints. There's 3 types of joints in the body. The vertebrae, from segment to segment, which is what a joint is, it's a synovial joint. So it's a specific kind of joint. There's 3 types. These ones are called synovial, and they make pops. Only those synovial joints, only those that are synovial joints will make those audible pops when manipulated or adjusted. So if you look at the nature of a joint, of a synovial joint in this case, there is the segment here. This is a joint. It's comprised of the inferior aspect of this vertebrae linked in with the superior aspect of this vertebrae. There's a joint here and one here. So the low back in particular, when I were to manipulate these joints, the person is in side-lying position and a force is applied with a very fast thrust, and the idea is that we are cavitating or inducing movement at these structures, the joints. I hope that makes a little bit of sense. Yeah, this is a model of the low back, the lumbar spine. So when it comes to pain of the low back, there's many structures that are innervated, which means that they have the potential to cause you pain if they are injured. The joints, the muscles, the nerves themselves can get injured. Fascia as well. Fascia is this connective tissue that has been found to be innervated. So you can actually have fascial pain, myofascial pain, as well as ligaments, tendons. So it's a very broad, big structure, and a lot of different components can actually cause irritation and pain. There's 2 in particular, 2 aspects I want to talk about today: pain when you're forward bending or flexion, and pain when you go into extension. For somebody that comes in and says, this is a very brief snapshot, so keep in mind that it's a quite complex picture with many factors to consider, but if we were to just diminish it to 2 planes, 1 plane and 2 movements in particular, flexion and extension. If somebody has pain when they are bending forward and they feel locked up and there's radiation or referral of pain down, then you want to try some spinal extension movements and see if those help you. And that's really specific, again, in particular, if this was a diagnosis relating to the discs. And I'll show you where those are in a second. I forgot to point them out on the model. The second component of that sagittal plane, that's your extension. If somebody goes backwards in a back bend and they have pain, usually you want to go in a flexion movement to help relieve it. The idea is that in extension, you're jamming the joints. So you're extending, you're actually compressing through these structures, through those joints, and as a result, they don't like being so close together. They're being jammed into one another, so they'll give you a little bit of pain or discomfort because they reach that end range that they have. These, by the way, are the very famous discs of the low back. So between segment to segment, you have this collagen matter There's the annulus fibrosus and the nucleus pulposus on the inside. That's what comprises the intervertebral disc. It's collagen. There's many things that can go wrong with these discs. For the most part, if it's a bulge or a herniation, the common position where that tissue matter expulses through is posteriorly and to one side. So that's called a posterior lateral disc injury or discogenic low back pain. Now again, the range of disc-related back pain varies, and it's actually on a scale from extrusion, from all the way from a bulge, which is sort of a minor problem, to all the way of the material being expulsed out and having a complete herniation with a prolapse of disc material. So it's on a range. Now, where was I? With forward flexion, if you have pain and if you've been diagnosed with what is discogenic low back pain or radicular type of symptoms of back pain, then you want to go into what are called McKenzie extensions. I'll demo those. And you want to do something called nerve flossing. If, on the other hand, you have pain when you go into extension, and that's again the joints being jammed together, you want to go into flexion, and that's when you bring the hips into your chest and try to sort of massage the low back, let it open up. Now I'm going to demonstrate a couple of these movements. I hope that you can hear me because I'm not mic'd and my videos are still quite raw and very basic. So I hope that you get the gist of some of these movements. So the first thing I will do are called McKenzie extensions. This is a protocol to help relieve pain off of the structure of the disc in particular. So it looks like this. You would be on your stomach, and there's 3 different levels to McKenzie extensions, and they're usually held between 7 to 10 seconds in each position. Similar to what people might refer to as a cobra move in yoga. However, it's slightly different because you don't want the muscles of the low back to be engaged here. The whole point is for the spine to be passively put into extension. So it looks like this. You start from a neutral plane. Take a breath in, exhale, and then push through the upper body so that your low back is in extension. Right now it's a lordotic curve, a concave curve. You hang out here for 5 to 7 seconds, and then you lower back down. And to start again, take a breath in, exhale, and rise up. Holding for 5 to 7 seconds. So that's kind of stage 1. If a set of these do you good, you should do at least another one. Usually the protocol advises that 50 to 60 of them are done in sets of 10. So it's 5 to 6 sets of 10 repetitions. Next stage would be that your arms are down by your chest. So take a breath in, exhale, and then you're half up. And this whole time my low back is completely relaxed. The muscles are not engaged. That's not the point. The point is just to put the spine in extension. After you've done a set of 10 of these, you can try the full extension, which is here. Next, I will show you knee to chest exercises. These ones are done for individuals who are experiencing pain when they go into extension. So it's a simple act of bringing your knee to your chest. I like to hook behind because hooking over here, I find puts a lot of compression on the actual joint. So the idea is just to let that leg hang in here. Move it around a little bit, side to side, and then you switch. You can also do a piriformis stretch at this point. And lastly, nerve flossing. So nerve flossing is going to be a hard one to demonstrate in the way that the camera is positioned right now, but the idea is that I would extend my knee out, point the toes out, look up to the ceiling, and then head down, knee bends and toes point down. And it's similar to if you were to be flossing literally with a string. The idea is that the nerve has a starting and an end point, and if it's tethered up or caught up in some tissue that is tight or dysfunctional, or there's material in a place where it shouldn't be, like a disc bulge or a tear, then it clogs or stops the pathway of the nerve from moving through. So you're taking it from one starting point to the other. Lastly, I also wanted to discuss some low back sparing strategies. So one of the common things that someone can do right away in order to help alleviate some back pain is to avoid bending, lifting, and twisting. You don't want to do those positions because it might potentially provoke or cause further discomfort or pain. So no bending, lifting, twisting. As well, you want to try some ice if it's in the acute stages of pain. So within the first 3 days or 72 hours after you are injured, you're going to experience an inflammatory process develop. And the way that we cut down on that is by icing. After the 72-hour mark has passed and you're within the 3 days, the 3-week range, that's when the remodeling and the repair stage kicks in. And that is further extended from the 3-week time frame to the 3-month time frame, where for the most part just remodeling happens. Now, another low back sparing strategy is of course to avoid bending from your low back. And yes, you can use your knees, but if you use your knees and you're lifting something very heavy, you're going to wear those out as well. So if you look at these heavy lifters who are putting hundreds of pounds over their head, and you look at how they're doing it and what their biomechanics entails, it's actually bending from the hips. And that's your hip flexion, that's your squat. So there's lots of resources out there on how to properly squat and what to look for, how to do it properly. The idea is with the low back, you want to use the hips instead of bending from the low back, especially to spare your back, because we actually bend forward quite a lot in our day. You're putting on your shoes, you're bending forward. You're reaching for something somewhere in your kitchen, inevitably you're going to be bending forward. So try to avoid that excessively and instead use your hips to bend, similar to performing a squat. I hope some of this information has been helpful and that you had a look at the model of the spine so that you can kind of understand some of these structures now. So to recap, spinous processes, vertebral body, anterior elements, posterior elements, spinal cord, spinal nerves, intervertebral disc, collagen. And on this model, there is a bulge that happened. That red mark outlines material that is part of a disc that has unfortunately bulged out, and it's in a space where it shouldn't be. And that foramina, that canal that it's in, if you see there, there's a spinal nerve that's coming out that might potentially be getting pinched on. So that's the whole concept of a pinched nerve. The model is unfortunately not very good, but if you were to look at it from this angle here, if there is a disc, the disc in there that has prolapsed, if there's material out of the space that's usually contained within, the next space where it goes is right here, this opening. And within that opening, there's a spinal nerve. And if this gets pinched on, the usual symptoms that one can feel is burning, shooting pain down the leg, usually to one side. When it's prolapsed to the center, that's when you can actually experience pain, shooting, burning, severe discomfort into both legs. So I hope this has been a helpful video and that you learned a little bit about what to do, what not to do. Again, the two positions I discussed were flexion and extension provoked back pain. For flexion provoked back pain, you want to go into extensions, McKenzie extensions, and nerve flossing if it's of a disc related nature. If you have pain in extension, that's where the joints are being jammed together. You want to open up that area by doing knee to chest exercises, and piriformis stretches are always very helpful for everything. So give all those a try, and I'll see you next time for another video.